Hello, my name is Flavian Magari. I come from Tanzania, East Africa. I'm 79-year-old. Professionally, I'm a medical doctor, although I have retired. I came to India about 2 weeks ago, but the main purpose of my visit here in India was to bring my wife, who has eye problems, glaucoma plus cataract, and she was referred here by a friend who was here and who had attended some similar treatment and got better. So she recommended that we bring my wife also here to get treatment. So she did mention that while you are there, you may, take advantage of the facilities at Apollo Hospital. My first contact was Mr. Prasad, who is at the international desk, and I went to see him. He also provided me with some information and took me to that building there, the Preventive Services building. And I was received by Dr. So I was seen by my doctor there, Dr. Sonika. I think the first thing she did, of course, getting to know me and me getting to know her, and also took my health history, medical history. And through that, she was able to identify some areas which I need to be investigated. And we recommended several areas for investigation, which after we had finished our discussion, then I was taken around to see like the dietitian, the ophthalmology, not ophthalmology, but you could call it ophthalmology people and others who discussed my team, my issues, and also made some examinations. But I went through various departments. They examined me, they did tests, radiology part, renal doctors. To be fair, I have really received excellent services from the reception to the investigations, to being explained what my problem is and what needs to be done in terms of maybe medicines or changes in lifestyle. But all the things were done in a very professional way. Before I get to the end, let me say that during these investigations, there were some issues which were already known, even I already knew about, even from the past. But a major problem that was identified during the history taking and also during the investigations, which included MRI and scan, was the heart. The heart has a problem, and the cardiologist recommended that I do angiogram, which I did, and from that it was identified that I had some big issues to be addressed, and we have discussed how we will go about it. And before I leave India, I think I'll have gone through the treatment so that I may be safe. Could not have been identified if I had not come here for the Gen program. So that was a big advantage and big benefit, because otherwise I would have ended taking my wife to the hospital. That hospital as an attendant to her. We would have completed her treatment and I would fly home. But with this, before I go home, I'll have my situation controlled, my health in order, and I think towards the end, I expect to get a more concise kind of a package of what I need to do, what I should not do, what treatment I should take, for how long, how we should continue, and I think we'll continue to correspond, to liaise between me and my doctor. My stay here, I've enjoyed the way I've been treated from day one until now. It has been a very useful, very helpful experience, and I want to commend the doctors, the nurses, the people that helped in a way taking me from one department to another, kind of holding my hand. Let's go here, let's go there, let's go here, let's go there, taking me to the doctors and to other people. So that is something which is a take home to me, that the way one is treated here and the investigations that are done, thorough investigations, in order to identify if there are problems, identify them. If there are no problems, then even advice is very, very important, because we doctors, I'm a public health doctor, so I do understand that it is important for people to understand their health, to protect their health, to make sure that we change our lifestyles in terms of exercises, the way we eat, the way we handle stresses and so on. So this is very helpful. And I will definitely be, when I get home, I'll be recommending definitely I am going to recommend Apollo Then program to other people who get a chance to come here, or they may even decide, let me also go and check my health, especially for people who are older. Not young people, no problem, but older people, we have some degenerative diseases which we may not know, but which can be reversed or can be controlled. Thank you so much. Thank you, Apollo Hospital. Keep it up.